Hey, I'm Dr. Pappas with the Rosti Rehab Centers in Northwest Hills. This vlog will be about thumb pain. The common mistake that people make with thumb pain is that all thumb pain is one condition. That condition would be called DeQuervain's syndrome. DeQuervain's syndrome is aggravation of two key tendons, one that extends the thumb and one that brings the thumb into this position away, called abduction. The mistake that people make is that they overdiagnose this condition because they don't have tools, capabilities of figuring out what the other differentials, what the other possibilities are. So we're going to try to sift through this here in this vlog. So the first thing, we'll talk about four conditions. Pain in this area of the thumb right through here can be DeQuervain's syndrome, that's a tendon-related injury. Aggravation of the radial nerve, this is radial neuritis. It could be osteoarthritis of the first metacarpal phalangeal or the first carpal metacarpal joint, or it can be referred, cervical radiculopathy, referred from the cervical spine down into the arm. Let's go over quality of pain. When we're talking DeQuervain's syndrome, it is sharp stabbing pain directly over the tendons. That's classic for the condition. Whereas aggravation of the radial nerve will present with reports of keywords, burning, tingling, pins and needles, and numbness. Those are hallmarks of nerve-related injury, not typically tendon-related pain or discomfort. If you're having arthritis of the thumb, the base of the thumb, which is the most common area of the body for arthritis, it's provoked with dull, achy, stiff pain at rest. With use or abuse, working it too much, it can turn into sharp stabbing or throbbing. It can be either depending on too much or too little force through the area. And with nerve-related pain referred from the neck, again, burning, tingling, numbness, pins and needles are the hallmarks of nerve-related injury. So listening to how they report their pain and when they report their pain is critical for making sure that you're getting to the right diagnosis. The pattern of the tendon-related, DeQuervain's tendon-related tenosynovitis, it's worse with resisted contraction and worse with resisted use. So making the hand grip things repetitively or holding a steady contraction, gripping a weight, will have a tendency to be worse. Whereas a nerve-related condition, nerves do not like excessive stretch or excessive compressive forces. So you're listening to the history for things that stretch out, like this is a radial nerve stretch, this is one of the tests, or a compressive force through the tendon, through the nerve as well. Arthritis, again, too much and too little, that's key and critical. Too much force through a joint, not good. Too little force through a joint, not good as well. Whereas the neck-related referral from the neck, it is typically worse with static positions or repeated movements. If you move your neck into a repeated position over and over and over again, the person that's holding up a phone that all of a sudden starts to get tingling down in their thumb, the person that is at a computer screen over and over and over again where the neck is protruded forward, that triggers pain in the thumb. Those are hallmarks to listen to that this could be referred from the neck, all right? Or if they have any past major history or current history of trauma for the neck, that's another screening position. Let's talk about DeQuervain's, a tendon-related injury. How do you assess, how do you diagnose this condition? Well, it's resisted contraction. Hey, hold the thumb up against this resistance. And all of a sudden they report sharp stabbing pain over the tendon. All right, hold the thumb up, don't let me push against the thumb. They report sharp stabbing pain over the tendon. If you get sharp stabbing pain over the tendon with a resisted contraction, isometric, concentric, eccentric contraction, that lets you know that's the tendon form of pain in that area, and a progressive strength training over weeks with the benefits first starting approximately about 12 weeks. Oftentimes these protocols go up to approximately 6 months long is the recommended course of action. All right. If you start to get the burning, the pins and needles, the tingling, that's hallmark of a nerve-related concern. You would test that with a radial nerve stretch. This is a radial nerve-related test. The arm goes into rotation and into pronation. The wrist goes into flexion. The fingers point back. You tilt your head away. You are stretching maximally the radial nerve. If you start to get burning, pins and needles, or tingling from that position, it lets you know that that nerve is being aggravated or pissed off. Or the DeQuervain's position. I learned this as a test for the tendon. This is not resisted contraction. This is actually stretching the radial nerve down here at the finger, the superficial portion. This right here is a nerve-related stretch that stretches the nerve along this course. Burning, pins and needles, numbness and tingling with this position. Not tendon. Tendon is contractile based. This is a nerve stretch. That indicates to me you could have the nerve form of pain in this area. Whereas arthritis, you're looking at pinpoint pain over a specific area, right over the joint. You're looking for the history, too much force, too little force. Too much force, not good. Too little force, good. Feels better in between, in the middle. All right. For that, the recommended course of action is to reassure the patient. Hey, great. Some patients have this. They have no pain and no discomfort. Some patients do. Odds are with time you'll be fine. We're going to embark on a general resistance strengthening program, and you should be fine and good to go with that. All right. And then the other one, cervical radiculopathy. How do you find it? You find it with repeated testing of cervical motions, repeated flexion, repeated extension, lateral flexion, rotation, or static positions. If you find it, right, according to the MDT, Mechanical Diagnosis and Therapy Principles, load the directional preference if you find it. That's a repeated position the neck will go in that will reduce distal symptoms, centralize the symptoms, reduce overall pain, and improve any mechanical baselines that you've taken. All right. So this is how you sift through pain at the thumb, because it could be DeQuervain's or it could be other. I'm Dr. Dino Pappas, the Radial Rehab Centers.